This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to a super show. I think we're allowed to say super. We can't say the other word. All right. So good to have you with us. As always, it's Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT. As you heard the man say, Dr. Molly Fantasia is here, and she is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll go over everything that Innovative Medical Associates does and how it relates to you and your family and the overall health picture. So we'll do all of that in the next hour. And, of course, we welcome your participation at 855-839-1210. That's our number here in the studio, 855-839-1210. Again, Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. It is a super Sunday.
It is a super Sunday, despite the weather, right, John?
That's right. And we're getting rain where we are, and hopefully we don't get too much.
Hopefully there's not too much snow up in Marlton or up in Philly where a lot of our patients come from.
Okay. Let's talk about Innovative Medical Associates, and we always like to start for those who may be listening for the first time, who may have listened but don't quite get what you do and what you're all about.
Well, it is a difficult concept. It really is, particularly when you come out of the traditional model. So Innovative Medical Associates is just a cooperative. The healthcare providers come together, and we believe we do the best we can for a patient in a primary care facility setting, which is what I have. And so if you have any type of problem where you need a medication, obviously we can write for it. Dr. Mark is a wonderful guy. He'll write a prescription for you, assuming it's medically necessary. However, the philosophy of Innovative Medical Associates is that we like to use the least amount of pharmaceutical that we can to effectuate the medical challenge and also improve your quality of life by reducing the side effects that are associated with the prescription meds. It's pretty simple.
And I think another word you want to use is supplement.
Oh, yeah.
Because what your hydration
does is
supplement what maybe some medications may do.
And so in that arena, the hydration is the vehicle to deliver these natural products like vitamins, minerals, amino acids that are God's ingredients, deliver those in an appropriate form and dosage to help the patient supplement whatever medical medication they may be on, and then effectuate the change, improve their quality of life. I think we have one goal in mind. We want to improve a patient's quality of life.
When you're talking supplements, you're not just talking about what you get in the health food store.
Oh, no,
you're talking about your hydration, your IV therapies.
Right, exactly.
Which are the major supplement, right?
Exactly, because we found that people who do the combination of both some oral supplements, good ones, mind you, good ones, and what we use in the IV, in the hydration bags, make all the difference in the world.
It's interesting because when we always talk about this, you get phone calls and people say,
goodness, yeah.
Dr. Molly, but I go to the health food store every week and I pick up this. Now, can I pick up that? And they'll go through a list of things.
Talk about a big list
exactly.
Of things.
Talk about that kind of thing.
Well, that's great. It's okay with us, but the point is, do you really know what you're getting? That's the key. The key is you need advice in this. First of all, you're never going to get the kind of dosing that's appropriate to effectuate the change that you're looking for by using the oral supplements only. That is a philosophy. That's my opinion, which is why we do what we do. And in addition, the quality of the supplements that you can get at health food stores varies greatly by the stock that they carry and the knowledge of the health food store people. That's it in a nutshell, John. And you've gone in and you've said to them, hey, listen, get me something to help improve my vision. And they send you over to the corner aisle and there's like 20 items.
Exactly.
Which one of those 20 do you want?
well,
and what are you trying to improve?
Right. Let's bring in your Nurse Barber because Nurse Barber says, okay, you go to aisle 4, all right?
Yeah,
and you go to the shelf 3.
Yes.
All right, and it's on the right-hand side, and so I mean, you don't have any of that.
But here's the thing, I would say that honestly, even in terms of Nurse Barber, she won't necessarily say you have to go to that health food store to get that product. What she says is, here's what we recommend because we have the data to support this, and you might be able to get it at this one or another one or anyone. Or order it on the web.
Yeah, a couple of weeks ago, we were talking about COVID, which is the and you said, you want to get some zinc, and you told me the amount.
Yes.
And I went to the store and I said I need zinc, and I think it was 50. You told me.
Yes, right.
And I got it.
Good.
So I mean that's
but that was to augment
exactly.
what we give you because we give you trace minerals in many of our IVs, but you want to do them carefully, John.
855-839-1210. That's our number here in the studio if you have a question for Dr. Molly. 855-839-1210. Really the cornerstone of what you do is the hydration.
Absolutely.
And you just mentioned like what you give me in my bag, but everybody is different, and their bags are based on what their needs are.
Right, and what we're doing. And we also like to stay on top of what's going on for our patients. So, for example, if someone comes in this week, let's take one of the cancer protocols, and we saw that one of our patients is doing extremely well, and he said he has to go in for a CT scan. Well, guess what? I have a little goodie in our bag that can help him get through the CT scan without worrying about some of the side effects of, let's say, the wavelength of the CT scan. You want to be particular when you will have cancer. You don't necessarily want to put your body through a lot. I'm not saying don't do what the oncologist tells you. I'm saying there are many things we can do to help you do it and do it better.
Once again, that word supplement.
Right, exactly.
Is what we've been talking about.
Right.
That what you do supplements perhaps the need for not prescription.
The need, yeah, but possibly for a prescription to maybe relax you, maybe all kinds of things. Obviously, what we want to do is we just want to help patients do what they need to do to see a change in their status and have good quality of life no matter what their condition.
Saturday and Sunday must be the day for prescription medicine ads on TV.
Oh, my goodness.
I was watching TV yesterday.
There's a whole bunch of new ones.
Every commercial break was a medicine, some kind of a medicine.
You know what's interesting, John? I am so blown away by the injectables that are coming out, right?
Yeah.
Stuff you have to give yourself and all the side effects. And they spend, out of that 30 seconds or 60 seconds, they spend, go to your doctor if you see this, if you have that. If you have, don't forget your liver. You can have a problem here, right? And they go through the list. It blows me away. So isn't it nice maybe to do something where we can eliminate maybe one or two of the present medications you're on without putting you in harm's way? And by the way, that's a medical judgment that my medical physicians make for you, not Dr. Molly. But it's interesting when you start to collect the data from their laboratory and see the improvement in, let's say, in liver functions or the improvement in A1C, which is an indication of diabetes. So, you want to look at these things and say, is there another way to do something? You know what I always say, there's always another bus.
Well, that's true. And we've talked about this before on the show. And again, to mention that you've done that for patients where they've been on a certain regimen of prescription meds and you've been able to cut it down or cut it out completely.
Sometimes. And again, we want to do it carefully, judiciously, and with the help of their traditional doctor and with the help of my traditional board-certified family practice guide.
All right, we're coming up on our first break of the morning. Our show is called Health Watch, and we're here every Sunday from 8 till 9 on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PH.D. doctor and executive director and founder of Innovative Medical Associates, located in Marlton, New Jersey. And with Dr. Molly, I'm your host, John DeMasi. Again, our number, 855-839-1210. We always tell you early is a good time to call because at the end of the show, some people call in and we can't get to you because we have to leave the airwaves. Pretty simple. 855-839-1210. Coming back with more of today's Health Watch after these words. Welcome back to Health Watch. As always, during the show, operators are standing by at Innovative Medical Associates. And the number is 856-489-0505. You have a question. Most importantly, you want to sit down and go over everything with Dr. Molly, the initial consultation. You want to set that up, that appointment. That's what you do. You call that number, 856-489-0505. And remember, the initial consultation is complimentary. And don't forget the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And of course, our show is Health Watch, Sundays 8 till 9, right here, Talk Radio 1210, WPHT. Let's go to the phones. Janet is in West Deptford, New Jersey. Janet, good morning. You're on with Dr. Molly.
Good morning, Janet.
Good morning. Hi. CBD gummies. Tell me about them.
CBD gummies. I think CBD on the whole has a lot of good. It has a lot of good things that it can do for you. The question is, what is the strength of your gummies? What are you using them for? And how are you using them? Am I against CBD? The answer to that is absolutely not. I believe that it has a really good place, particularly for a calming effect. I've seen it work well for sleeping. I've seen certain types. I've actually seen tincture work better for some inflammation, like, in terms of joints, etc. But I think it really depends on what type of gummies. I'm not thrilled about any gummies because they contain certain sugars, right?
That's what I was wondering about, the amount of sugar in them.
Now that's a different question. Yeah, I don't think I like tincture the best. If you're asking what we use, I like tincture the best because it's a direct hit. And I like to know exactly how much CBD is in these products. In other words, just because they say they're hemp related or whatever, you want to make sure that you have enough of the cannabinoid, the CBD in it to effectuate the change you're looking for. Were you using it for sleep by any chance, Janet, or pain?
Oh no, I was just came to me on my computer, and I see. Just questioning it. Do I want to do this?
Well, I'll tell you. Why don't you look and tell me how much of the CBD is in it, and would you be using this for pain or just overall good health? Tell me, just give me a little more specifics.
Well, I don't know about the sugar in it. I don't have
like
it.
it.
I don't.
Yeah.
Okay.
I don't like it.
I would be using it for overall health. Yeah.
Okay. Well, why have the extra sugar, or more than that, the sugar alternatives like aspartame or sorbitol or any of that? I just don't like that. So the tincture is probably the best way to take it, and you can actually get an indication of just how much of the true CBD is in it, Janet. And I think that's important. Okay? Bless you.
Thank you much.
Bye.
All right, Janet, thanks a lot for the call.
I don't want the CBD makers to start yelling at me tomorrow, which they will do, as you know. Yeah. But I'm saying that I suspect that CBD in gummy form has a place. I mean, obviously, if someone can't take the tincture, I don't know, because they don't like the bitter aftertaste or something. Maybe it does. Maybe it's better to have a little. But I just don't like sugar-related products. Does that make sense?
Well, it's not good for you, right? I mean,
yeah. I mean, we all know refined sugar is not good for you. But, and actually, it was something I was going to talk about later in the program. One of the medical pearls of wisdom that I saw this week was that these added sugar, like aspartame, sorbitol, and actually some other things like MSG, can contribute to someone having a fib. So, yeah, I look at that.
Yeah. Okay. 855-839-1210. That's our number here if you have a question for Dr. Molly. We have often talked on the show, Dr. Molly, about stem cells.
Oh, yes.
And
yes.
Exomes, is that what it is?
Exomes.
Okay. What is that?
So exomes are the small vesicles that are in the stem cells. And see, they need that that's what works to repair. It's the exomes that contain the growth factors. So here's the thing. We believe in using outside stem cells. So, and they are collected ethically. Please, people out there, don't think they're collected from aborted fetuses, that kind of thing. These are collected from live births. So the thing about the exomes is they have an additional advantage compared to the stem cells that they collect from your fat or your bone marrow. First of all, they don't create inflammation. Okay, therefore, many times, no steroids are not necessary. And that's very important because what do the steroids do? They actually suppress inflammation. When they're putting it in, they want to suppress your immune system. Well, I would want you to use the cord-derived stem cells, exomes, right, are more effective than the stem cells found in older people. I would just by common sense. So that's one of the things, one of the reasons why we use it. And I've used it extensively on my arm. That is slowly but surely improving. We believe in PRP, which is the platelet-rich plasma from yourself. In addition to that, but again, we're looking at the platelets and their growth factors. So really, in the end, it's literally not the stem cell itself, but what the stem cell contains.
Is this what you use for your patients?
Yes,
okay.
I use it a lot. I particularly use it for the neurodegenerative diseases and for the repair diseases, like if someone has a tissue tear or a ligament tear. In fact, we just went and looked at an x-ray on one of my cancer patients, and she has a small tear in her knee, and I'm pretty sure in the meniscus. I'm fairly confident that a direct injection with this from one of my wonderful docs is going to take care of that for her.
And you're saying that steroids are not needed here?
Not in doing what we do,
right?
In fact, we tell you to get off all anti-inflammatories several days before and after the procedure.
And steroids, when they're used, what's the downside to that?
Steroids, when they're used, they're there to help hold down inflammation, and we want to create a little inflammation, but we want to create it in the right way. So we're trying. Listen, when you have an injury, what do you think happens? This is what I talk about, good inflammation. It happens that when you have an injury, the body's creating inflammation to heal the injury. Well, we want to help that creation, is what I'm saying.
Okay, so that's why you
we like outside.
Okay.
We like the outside, you know.
Because I've seen
I
this.
won't say that my doctors have never used corticosteroids as an injection to help relieve pain. I won't say that. Of course they have. I mean, that's a traditional way you help people. In fact, I sent you to a gentleman this week.
That's right.
Who's probably a very well-known pain management guy, and I would certainly take an injection of corticosteroid in the short haul if I needed it. But I'm talking about steroids in general are not great for the long haul.
Okay, so you see all these ads for stem cells.
Yeah. Some of them are just out there. I mean, what they're claiming they're doing, I believe that they are 21st century medicine. I'm certainly using it on my arm. But again, look, guys, I've had this on for over a year. I'm not a baby. I mean, the surgery probably would have repaired it much quicker. I didn't want to go through a full-fledged surgery. But I will tell you, I'm doing some PT now, and I think I'm moving along pretty well.
Let's say people are listening to this and they have an issue and they're thinking, I wonder if I'm a candidate for stem cells. So who is a candidate?
Well, I would say
if
you need a repair of any kind, if you're having knee pain, if you're having elbow pain, joint pains. And here's the interesting thing. If you're having this type of pain, okay, literally, if you're having this type of pain, there are things I can give you in the bag that will help you get ready for the stem cell injections. And that's the key, too, because I use an awful lot of homeopaths that really enhance your own stem cells. So, again, I don't do anything on anybody that we haven't done on myself.
I know you've had a lot of patients
yes.
Who have done this.
Yes.
And it's been fairly successful for
right.
all of them.
It's been very successful. Now, am I going to tell you it lasts forever? Well, I don't think anything lasts forever, including us.
Right.
Right?
right.
We somewhere in here,
right.
you know. But I would say for the most part, it certainly has worked, and it seems to be a less cumbersome type of process than going in and having these things taken out of you and injected back in you, because that's more like a surgical kind of thing.
Right.
And again, we like to keep people from surgery if we can help it.
Well, that's part of the whole philosophy.
Exactly.
Less is more.
Less is more.
Okay.
But again, if you need surgery, you'll hear Dr. Molly with the cancer patients. You need to get it out. If
That's
you
right.
need surgery and it can be done, do it.
All right, we're coming up on a break here. We're at the halfway point of the show, and we still have plenty of time to talk to you. If you have a question for Dr. Molly, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And, of course, featuring Dr. Molly Fantasia, the Ph.D. doctor and executive director and founder of Innovative Medical Associates, Marlton, New Jersey. Again, that number here, 855-839-1210. You have a question, you have a medical challenge you want to run by Dr. Molly? Well, this is the time to do it. 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates. If you want to find out more, or if you want to make an appointment to sit down with Dr. Molly, remember the initial consultation is complimentary. 856-489-0505 is the number. You can call now. You can call after we leave you at 9 o'clock. You can call later on this afternoon. You can even call during the game. How's that? 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And again, their website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. And again, our number here, 855-839-1210. Before we get to what we're going to talk about, Dr. Molly, I know a lot of times when people sit with you in the initial consultation, you do spend some time explaining how you can potentially help them with their problem.
Of course.
And a lot of times they don't quite get how it works, even though we talk about it often enough here on the show.
You got to come in and see how people are doing. And you know what I love? I love when my patients call here and they talk a little bit about what's going on in the clinic from their perspective.
Right.
And I think it's really important for other patients to meet people. And in our place, by the way, we don't break HIPAA. The patient gives permission to talk to the potential patient about what's going on and why it's been working for them.
Right.
And I think it's important.
And your patients take good care of me. I mean, I get jelly,
I
get mustard.
And you know the truth? Our patients are really, really wonderful people because, again, they're thinking people. They don't just shake their head yes to every single thing and say, okay. And they dialogue with us saying, listen, I read this. What do you think of this? Can we get it? Oh, and by the way, Dr. Molly, have you thought about putting this in my bag? That's what I love.
Yeah, absolutely.
So it's great.
All right, 855-839-1210. We've talked often, Dr. Molly, about vitamin C, but we're going to talk about vitamin D and its benefits.
Oh, yes. Well, vitamin D is used, as we all know, for many things, but it's also used as a protective, of course, we know, for the bones, and we also know that overall vitamin D, of course, when we're talking about our COVID population, we say we want you on vitamin D as well as C. But what's interesting is that vitamin D really needs magnesium to work, okay? So what's happened is that many people are taking vitamin D supplements, but when we go to find out, they're really rendering their vitamin D useless because they don't have the magnesium to help support it and to utilize the vitamin D the way we want. And as you know, I actually have an injectable vitamin D in grapeseed extract because I didn't like how the commercial vitamin D was given in an oil. But I will tell you that we have to recommend taking some magnesium. And interestingly enough, even the USDA, which is hard to believe, recommends 420 milligrams of magnesium for men and 320 milligrams for women. In the standard diet of the U.S., you're only getting about half. Now, why I find vitamin D so interesting is only 1% of the vitamin D is in your blood. So we measure vitamin D in serum, right? You know that. You'll see it on your thing. So is that really a true indication of what's going on? Because vitamin D is stored in the cells where it can be used. So there is a test out there that we can do by doing a cheek swab. It's a little bit, it's not covered by insurance, which is why I don't always use it. But what I have been able to do in doing this in a small group is I've been looking at the vitamin D levels I get back from the swab, comparing it to what I see in the blood, and doing a little mathematical equation, nothing like very, very important, but looking at the ratios and seeing approximately how much more vitamin D my patients really need.
If you're taking vitamin D,
yes,
does it follow logically that you should also be taking magnesium?
I would, and interestingly enough, we give magnesium in our bags in the hydration, because the very point is when we see really low levels in the serum, we know you're probably low in the magnesium as well. And when we do the blood work, we see it. Magnesium is a mineral that has been really relegated to a low low priority. And you know what? It shouldn't be, because it helps with migraine headaches, and we've known this for years, the magnesium, as well as vitamin D. So, you know, when I look at vitamin D for my patients, I want them to be in a really good range. And I've had a lot of discussions with Dr. Mark about this. So the range in the blood level runs around 25 maybe and up. But you know what? And maybe to 100. I like to see our patients in the 80s all the time consistently. That's telling me they're getting enough use of their vitamin D, because there's no point in there's no point in taking anything if we're not using it properly and making sure we're optimizing your cellular function.
Well, you told me when we were talking about, again, back to that bad word, COVID, we were talking about it, and you said to me, vitamin D, vitamin C, which I'm getting, and zinc,
right?
And now, of course, you're talking about magnesium. Right. So these are all important ingredients.
And what I'm saying is, when my people come in, we obviously have the magnesium in an appropriate dose in their hydration bags. So what I'm seeing is, if people do what we ask them to do, maybe we can help keep their immune system where they need to be, their cellular energy where they need to be, and maybe we shouldn't worry so much about the COVID, because all we're hearing this week is how the COVID virus mutated.
Yes.
There's a new strain. Well, folks, that's not new news. The flu has mutated. That's why sometimes when you got a flu shot, was it ineffective? Did you get the flu?
No.
Yeah? No, you do. You get the flu.
Yeah.
You got a flu shot. You could get a different strain
That's
of the
right.
flu.
That's right.
So,
yeah, you're right. Yeah, you're right.
Yeah. So what the heck? It's the same thing. So the media is killing us with all of this information, and it's all accurate. It's all accurate. But, how precise is it?
Yeah.
There you go.
And,
the age-old science question.
That's right. As speaking of, this week, of course, we had the snow, and you were closed on Monday, and Tuesday you were closed early.
No. Yeah, I closed early, but we came in a little later.
Right.
But we tried to keep all our
So
patients.
I missed my Tuesday.
Oh,
and
man.
I felt it on Thursday.
Did you?
Yeah, I actually felt like there was something missing, like I didn't feel as good.
Okay, and you were over. Listen, John, you've been overworked too. Plus, you have a little bit of an issue that we're taking care of this week, and that wears you down. You know what I believe, John? If people are in pain, it wears them down no matter what.
Yeah.
And so you want to effectuate the change in the pain levels the best way you can, which is another reason why you missed your drip, because, as you say, after your drip, you got pain relief for several days.
Yes.
So, yeah, there you go.
Yeah, so just wanted to point that out so people understand that this is not just, as you say, this is not just holy water.
No. And my patients will tell you that.
Yeah. A little bit on vitamin C, because we always talk about that, but we're talking about vitamin D. Vitamin C, a variety of issues.
Well, one of the things, I have several cancer patients, right? And many of them, I would say, the cancer supportive therapies, assuming that the patient has the enzyme to appropriately use the vitamin C in a high dose, and that's very important. And we run that after the first drip, because the first drip we're really checking to see how you take the fluid, and we give you a little half dose of the vitamin C, just enough to, usually, and we don't want to create an anemia. So one of the things that happens is we are looking at the vitamin C in levels that we see really help our cancer patients. And the proof of that pudding has been in several of our patients have come back with their studies this week because they're that far along in their traditional cancer protocol. And interestingly enough, even in a very severe and long-standing cancer, one of my patients has had cancer since 2001.
Wow.
And she has the cancer has migrated from a breast cancer to others, and I'm not saying it's been a joyride for her. But was interesting, they did a CT scan of her entire body. No mets to the bones, no mets to the liver. This is the breast cancer. And one of the lesions, the original lesions that she had a small reduction. That's a big deal.
Oh, sure it is.
Now, I believe that's a miracle, and I say it's the big physician upstairs. We put our trust in God. I believe he had a hand in this. But the point is that she's doing pretty well, given how long she's had the cancer and how she didn't have treatment for a very, very long time.
And by the way, you have several people of the cloth who are patients of yours.
Yeah.
So
yeah,
that helps your pipeline to the man upstairs.
Well, I hope. I really hope. But bottom line is, and one of them has a severe cancer. He's being treated, and he was able to take a chemotherapy holiday because of what he was doing with me.
Okay, more to talk about here on the show. Coming up on our final break of the morning, it's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We still have time for one or two more calls. You want to get in here now, 855-839-1210, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and founder of Innovative Medical Associates, located in Marlton, New Jersey. And with Dr. Molly, I'm your host, John DeMasi. We return more of today's Health Watch after these words. Welcome back to Health Watch. A couple of minutes left of the show. If you want to contact the operators who are standing by right now, you want more information about Innovative Medical, or you want to make an appointment with Dr. Molly, because that's really where you get a lot of the information and how it could relate to you and your situation. Call the number right now, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And as I've said, they will be there well after we leave you at 9 o'clock. They'll be there all day. And that's the number during the week as well, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. We have E.M. in Chestnut Hill. E.M., good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, E.M.
Yes, good morning. I enjoy your show very much. I listen often. I'm a first-time caller. Okay. But thank you so much for the information. I have two follow-up questions about some things that came out in your discussion this morning.
Sure.
The first is regarding magnesium, and the second is regarding the CBD oil.
Yes.
Regarding the magnesium, what are your thoughts about supplementing with that for aches and pains?
I think you should supplement with some magnesium regardless. And as I said, if you go by the daily requirements that the USDA says, women need around approximately 320 milligrams, so we don't always get it. So, yes, I think it's okay. I think we have to be careful. And there's so much more, though, that we can do for pain and pain-related. So that would be a great discussion to have with you at the office, definitely.
Very good, very good. Okay, and the second follow-up question regarding the CBD tincture.
Yes, ma'am. Yes,
because you said you prefer the tincture over the gummies.
Yes.
If you take a drug test for work or something.
Oh, yeah.
How does that come up? Does that come up as marijuana?
You know what? It's a great question. It really depends on how much THC, which is the product that they're testing for, comes up in most of the drug tests. And I think that we have to be careful with that because it can pick up a trace amount if it's still in the product.
Right.
So
that's my concern.
Oh, yes. Mm-hmm. Oh, yes.
That's
and
my
it should
concern
be.
because you don't want to do a screen and it comes up.
You know
and
what?
If they don't give you a chance to explain yourself, then you could be
you're
out
in deep trouble. You'd be out of your job. So I'm with you. I'm with you. Let me tell you, I absolutely understand that, and I'm very particular about the brands. That's why you want to look at your CBD before you take it. Now, not all. Many of them don't have any THC in them at all. So there you go. Okay.
Okay.
All right,
thank
Ian.
you. And I'll keep listening.
All right. Thank you.
you.
Thanks
God
for the call.
God bless you, dear. Okay.
All right. Marilyn is in Bridesburg. Marilyn, good morning.
Hi,
You're
Marilyn.
on with Dr. Molly.
How are you?
Hi, Dr. Molly. Yeah, I'm calling because I wanted to know. I was vitamin D deficient about a year and a half ago.
Yeah.
Okay, but they had me on vitamin D. I've been on it for vitamin D for a year and a half.
Okay.
And
injectable, Marilyn, injectable or both? Injectable plus a vitamin D3, right? D3.
No injectable. No,
okay,
not
good.
injectable.
Good.
Just the vitamin D. But my question is, I just maintain taking it. I never stopped taking it.
Right.
So would I be able to safely say add the vitamin C and the zinc that they keep talking about for
the flu,
the COVID?
Yeah, I would. I'd take that. I would take it, sure.
Yeah.
I think everybody can pretty much take it, and I think
you're
absolutely right.
I'm taking all those
to do that, and I think it would be great. You know, make sure you continue to get tested though for your vitamin D level. Okay, that's really important.
Yeah,
very important. All right, very good. Remember, it's what's in the cells, not just what's in the serum, that counts. Okay, honey. Very good.
Right. And the magnesium. You say that the vitamin D will be absorbed better by magnesium. So is that something else?
I would say the utilization of the vitamin D is better. So 320 is the daily the official recommended requirement for females. And I would definitely discuss this with your doc who puts you on the vitamin D. You really, again, we should get that in our food or whatever, but most of us are deficient in it. That's what I'm saying. Yes.
In magnesium?
Yes.
Is that what you were talking
about? Yes.
Yeah, okay. Thank you, Dr. Molly.
God bless you.
All right, Marilyn, thanks a lot for the call. Appreciate it. Well, I'm taking what you told me, vitamin C, vitamin D, and zinc.
That's right. And you come in, I'm giving you magnesium.
Right, exactly. So I'm getting a double shot. Right.
Yeah, well, you're doing well. You're doing well, John.
Okay. All right, 855-839-1210 is our number. You wanted to talk about Dr. Glass, who's going to be on our show.
Harvey Glass. He's one of my medical consultants, and he's an MD. He was in dermatology for many years. And we started talking. I was lucky enough to have lunch with him one Friday. And he and I started talking about older folks and what kind of things we see in them that are not necessarily picked up by your primary care doc or are, and they're dismissed. But because he and I are both older folks, so we started talking about capillary fragility. That's when have you ever seen that you wake up and you have a black and blue or something? I'm not talking about ignoring that if you think there's an underlying medical condition like a blood dyscrasia or whatever, but you're perfectly healthy and you find that you have bruising and you actually didn't hit your arm that hard or any of that. Well, that's called capillary fragility, which means the capillaries are leaking out a little bit of that blood under your tissue. And do you know what causes that? A decrease in collagen. And what is a cornerstone of collagen, John?
Vitamin C?
Vitamin C.
Oh.
And that's the point. And we started talking about vitamin C and what wonderful uses this is along with collagen. Because, right now it's very hot. Collagen supplementation is very, very hot. Well, great. Supplement all you want with the collagen. If you don't have enough vitamin C, you're not going to utilize your collagen. This is the beauty of God's creation. Everything works in tandem. There's a reason why we look at all of these analytes, not just a particular thing and say, that's your magic bullet for helping you right along. I'm one that take all kinds of collagen. I take collagen. I definitely do. And I look at things like hyaluronic acid. I use that IV. So there are many, many ways to deliver the collagen and actually help the body utilize it. But vitamin C is a big one, and you know you love vitamin C.
Absolutely. And real quick, Dr. Glass and yourself developed a skincare line.
Oh, right.
You go on the website, you can check it out.
Hydration. It is a hydrating product. It is unbelievable. All skin types. And I'm having such great results. So I'm using it myself, John. You should be using it. It's something I'll make sure the girls carry this week. Okay? All
right. And that's going to put the wraps on another edition of Health Watch. How about that? Okay. Time flies when you're having fun. That puts the wraps on another edition of Health Watch. As I said, operators standing by right now. They'll be there well after 9 o'clock. If you want more information, you want to make an appointment with Dr. Molly, 856-489-0505 is the number, 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses, Jess and Crystal, and our medical assistant, Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 1210, WPHT. You take care.